Hello, my name is Dr. David Cowan. I'm a reader in the Institute of Strategic Leadership and Service Improvement at London South Bank University, which, as the name suggests, is in London in the United Kingdom. One of my functions is to teach research methodology and strategy to postgraduate nurses and other healthcare professionals. Thus, I teach research in a multidisciplinary setting. I also teach on a module in our professional doctorate for nurses. The model involves generating evidence and knowledge through research to inform practice. Indeed, generating knowledge and evidence through research is now seen as an important contribution to nursing care, given the emphasis that is now placed in many parts of the world on evidence-based practice. It is against this backdrop that undertaking research is seen by many as an integral part of being an advanced nurse practitioner. Thus, it is no longer appropriate to justify practice based on claims such as, well, we've always done it this way, or basing practice on rule of thumb, taken for granted assumptions, or personal preference. Please bear in mind that in the early days of nurse-led clinics, it was research evidence which underpinned and supported their inception. However, we should not assume that no more such research is required. Indeed, in an era of perpetual clinical advancement, we constantly need evidence to inform and support our practice, and not least to facilitate continuing professional development and career advancement. Such evidence may be generated from quantitative research approaches, such as questionnaire surveys or randomized controlled trials. Conversely, it could be generated from qualitative research approaches, for example, in the form of eliciting people's lived experiences through in-depth interviews. Please do bear in mind that research does not have to be complicated, or as the saying goes, rocket science. Also remember that research can be undertaken in collaboration with colleagues from other healthcare professions. Going back to the example of questionnaire surveys, it would be relatively straightforward to develop a questionnaire to capture the opinions of your clinic users. In an age when in many parts of the world the patient experience is seen as paramount in providing evaluation feedback for clinical services, clearly the findings of such a study would be extremely useful. These findings could then be written up for publication or disseminated to colleagues in other ways, thus sharing knowledge on practice development and improvement while simultaneously raising the national or indeed the international profile of nurse-led clinics. So, I hope this has been useful to you and wish you success in your endeavours. Thank you and goodbye.